big nerve, and it comes right down on the heart, and it's so this is, epinephrine is go, 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 and vagal nerve is stop, stop, stop. So if you ever heard of someone passing out because they see blood, or, I don't know, needles, people are scared of needles, what else are people scared of? Anyone?
Spiders.
Spiders, some people are scared of spiders. It's the vagal nerve's fault. Because it comes down, and it's a stop, stop, stop signal, right?
Yes.
So if you slow down the pumping of your heart, and you have it pump less, what drops? So your heart will go down, but your cardiac output, right? Because the cardiac output is absolutely terribly important. No cardiac output means we don't perfuse the most important organ in the brain, or in the body, right? No blood to the brain, the cells don't have oxygen, and they stop working. They go on break, basically. And you kind of, pass out. So if you ever see someone pass out, it's because they have too much vagal nerve because someone has shown them a needle or something like that. And so the first time you see it, it's actually pretty surprising. People just kind of slump down. But this is why. And it's also the reason why if you stop someone's heart, well, they don't look at you and go, I think my heart has stopped. What do they do? They pass out, right? They're sitting there and they're like, oh, I don't feel good. Boom. What?
That's what happens when people black out.
Most of the time, yeah. It's their heart. And the other thing to think about is gravity is actually a really big pain in our body that we have to live by the rules of gravity. Because I'm standing up right now, where does all the blood in my body want to go? Down, in my legs. And where's the most important part of my body?
Your brain.
Exactly. So that's not good, right? But if you pass out, what do you end up doing? You lay flat, right? Yeah, so you're no longer fighting gravity. So this is one mechanism, kids, for example, will hold their breath when they get mad, or they'll hyperventilate, because kids are they know how to get you. What happens is they hyperventilate, they hold their breath, and they'll pass out, and as soon as they hit the ground, first of all, they pass out and they stop holding their breath, and second of all, they start perfusing their brain immediately. And that's one of the reasons you see people in the hospital, if you ever watch ER, you guys don't watch medical shows, do you?
Yeah.
So whenever anything bad happens, you may not have noticed it so far, but if you watch TV going forwards, the first thing someone does is they come in and they put the head of the bed down. And that puts the person down like this, and you start perfusing the brain more and more. You're not wasting circulation in the legs. So we're always fighting gravity.
How come, when you're standing up, your blood doesn't rush to your feet? When you do a handstand, your blood rushes to your head?
Because arteries are awesome. My central theme. So right now, the best example is if you sit down, or even better yet, you lay down. So you sit down like this. The blood is pooling in my legs, right?
Sure.
Or it's at least being pulled down there. And sometimes people sit down, especially old people, and they stand up real quick, and they're like, ooh, I shouldn't have stood up so quick. Right?
How old are you talking?
So you ever stand up and you get dizzy?
No.
The reason is that the blood is pulled down here, you stand up real quick, and there's not enough, you get up and you start to exert yourself, you need more blood flow, right? The heart hasn't responded yet, and all the blood's stuck in your legs. So if you sit back down and kind of relax and get gravity start to get back on your side, it gets better, right? Same thing, it's just all because the arteries clamp down. So all you do is you smush these arteries in your legs and shunt all the blood up to your head. So within a second or two, all the blood's back and you're not feeling like you're gonna pass out. Because if you don't get enough blood to the brain, you pass out. And so that's why you're laying down, you sit up too fast. Same thing.
When you get headaches and migraines, does that mean you're not getting enough blood flow to your brain?
Migraines are.
It's your skin.
Yeah.
It's not your head.
It's actually really not.
It ain't your skin.
For migraines?
What about headaches?
The brain does not have any pain nerves, which is really cool. So I've actually done helped people do surgery where they're awake and you're operating on their brain because there are no pain nerves in there.
Wow.
So you have pain nerves in your skin and not in your skull. So once you get through the skin, what we do is put people to sleep. I guess cut a big hole in their skin, which hurts if they were awake, but they're not awake. We peel it back, and now we wake them back up. I take it back. We drill the holes first. We drill a hole, then we take a pull piece, and then we wake them back up, and they're awake. And what you do is you can stimulate their brain while they're awake, touching their brain, and be like, count to 10. And so you put a stimulator on there, and there's some pretty amazing things that happen. One of my favorites is if there's one part of the brain you hit with this stimulator, someone will start counting, because we have people do stuff like count 1 to 10, do your ABCs, and they'll go 1, 2, 3, D, E, F, G, 5, 6, 7, and they'll switch back and forth because of where you're stimulating. It's actually really cool.
I would just do it.
You can move their arms.
Say if you sitting on the like say if somebody was sitting right here, or maybe it's just me. If I sit down for a long time and I jump, I get this feeling in my feet, and it's like it feel like it's just doing like that. What is happening?
You have a problem.
You're so harsh.
I'm not sure. Does anyone have any questions about medicine in general, real quick, before we go off into brain?
Oh, dang, I was about to.
No, come on.
So, what is it about the migraines? Like, so what causes it? Like,
So there's a coverage. When you guys go over Dura,
yeah.
all right. So Dura is. Someone know what Dura is? What is it? What's it look like?
It got layers.
Yeah.
It got some layers to it.
So
I know
exactly. It's kind of like a leathery sack covering the brain up, right? And it's the one exception of the rule. The Dura has pain receptors in it, unfortunately. And so the thinking with migraines is probably actually the Dura. There's some issue with the Dura, either not getting enough blood or just being generally unhappy in the world. And that's why it feels like it's really, because you feel like a headache's really in your head. It doesn't feel like the skin as much. And that's why they think it's probably Dura getting upset.
But you have it.
I
can
get really
feel
mad
what
at me.
my headache is. I can be like it's right here.
Yeah, and it's probably that part of Dura that's affected.
Sometimes
What's wrong with it?
Why I be getting
Yeah, it be
It's
pulling.
probably
It's so mad.
It be feeling cool, so I just do this. So then,
Earlier you said that when you have like new parts of your body become active, they receive blood immediately. Like how does that happen?
It's actually very cool. So remember when we talked about lactate? I didn't talk about it. I said that when you work out, your legs burn, right?
Lactic acid.
Lactic acid. You guys know where you get lactic acid?
No.
Your stomach, intestine.
No. So you guys got over aerobic, anaerobic metabolism?
Yeah, one is when oxygen.
So
gets
aerobic
there.
meaning
Oxygen.
oxygen, anaerobic being
Not
no oxygen. Good. So what happens is, have you guys gone over glycolysis?
No. I don't know.
I heard of that.
So glycolysis is just a fancy word for breaking down sugar.
Oh, okay.
So you use sugar as energy, right?
Yes.
Normally, you guys remember mitochondria.
Yes.
The powerhouse.
Uses oxygen to to make. You guys know ATP?
Yes.
All right, good. ATP is the greatest stuff on the planet. Your whole body runs off ATP. You use sugar to make it. Now, when there's no oxygen around, which is, let's say you're working out and you're putting blood into your legs, but you're not in that great shape, so you're not getting enough blood flow there, there's not enough oxygen there. So what happens is you go into anaerobic metabolism, no oxygen. And the way that you do that is you turn glucose, your normal sugar molecule, into lactic acid. It's like a quick little shortcut. It's good because it works and it gives you a little bit of energy, but it's bad because it hurts like hell, right?
Right.
It's not sustainable. So, what was your original question?
You said that when places in your body.
There. All right. So what happens is your blood vessels are actually sensitive to lactic acid. So if you cut off your hand like this, not cut off your hand, sorry. If you cut off the arteries going in your hand, and it starts burning because you're like, I don't know, whittling or doing something people do with their hands that are fine. And it starts burning, the vessels in there sense the lactic acid and they relax. So when they relax, they decrease the resistance and you get more blood flow there, right? So it's kind of like that feeling if you clamp off your arm and or someone puts a blood pressure cuff on you, and they let it go, it's like, oh, you feel the blood come back down. It's the same situation as that. When they put that cuff on there, there's no blood going into the arm, which is okay for a little while. And when the lactic acid builds up, it causes all those vessels to just relax and get as big as possible. They become huge tubes. So you can get blood flow. As soon as blood flow comes back, it'll all go there because it's the path of least resistance. Does that make sense?
Yeah.
So that's the main thing is acid, lactic acid.
Is that what they say, like, when you work out, you get that buildup of lactic acid, like the next day you're supposed to work that muscle? Like,
landfill wipes go.
So you can just chill.
You can. You'll be a little tighter because your muscles. You actually tear your muscle a little when you work it out, and it repairs it by building itself bigger and bigger, so it doesn't happen next time. And so you'll be sore either way. If you work out, you'll be a little less tight.
You get a Charlie horse.
You can get Charlie horse without being punched.
You said, no, but,
Is this a leg question? Because is this a leg feeling funny question?
Is this a
No.
muscle question?
when you, okay, when you had a little blood pressure thing on you, it tightens, and you said no blood flows through there. So is it just, like, say for instance, if I was to punch him, which I know you wouldn't feel it, if I was to punch him and it was like real tight, you know how people say you get a frog in your arm or something?
What?
No.
You never see a frog
No,
where that
like,
vein pops up?
If somebody hurt you.
Like if you hit your arm, this little, like if you hit it at the right spot, like a little ball will pop up and then it'll move back. It's weird.
Sometimes it stays there for a minute.
So my granddad used to do
If
it.
somebody hit you really hard.
Like with
And no blood flow. Wait, so if I got hit really hard and like I don't feel nothing, is it just numbness or it's no blood flow? It's like really tight.
He don't know.
Never heard.
I never heard of a frog. It's not because of blood flow. You have plenty of blood flow even after someone hits
I
you.
did not hear
The
that.
blood flow actually increases because there's a little damage there.
Where is your child?
What do you do in South Carolina? What is
But you shot on the leg, not the arm.
That's how you can
That's
know
what
Charlie
Charlie
horse.
Anyone else? Questions?
You want to try? You want to try?
Wait, do your veins get tangled? Like my wrist be hurting sometimes, like, and I can't move it because my veins be feeling like they all tangled and stuff. So I just leave it. I just leave my hand like that, and then I have somebody eventually hit it, and then it really hurts, and then it just be fine.
I don't know if that's the best way to solve the problem. Veins can't get tangled.
Then what is carpal tunnel?
Carpal tunnel.
Carpal tunnel is, so, I think you can feel it. You may not be able to feel it if you don't know what you're looking for. So, edge of your wrist right here, there's a little band of tissue. So if you feel further back, you feel how this is kind of hollow right here?
Yeah.
And you go forwards, and then it becomes kind of a tight little band. That's not bone, you only have two big bones in your arm. Between these two bones, keep going forwards, you'll feel this little band.
Okay, I got you.
You feel it?
I found it.
Good. That is, it holds all the ligaments and nerves and arteries going into your hand. It's like a protective little sheath. Now, if that clamps down too much, it starts to strangle them a little. And so one of the things that's in there is the median nerve, and where does anyone here have carpal tunnel?
My mommy got it.
Do you know where it hurts in her hand?
I don't know. That's why she stopped braiding my hair when I was little.
It probably hurts, it probably tingles and hurts right in here. The median nerve goes right through here and it goes up like this.
I think I got it.
Does her whatchamacallit, is her thumb kind of like that?
Yeah, when she be doing something, she just sit down and she be going like this.
Yeah, so the nerve comes through there, and when it gets upset, it doesn't. One of the things it does is this.
When I wake up, my hands keep the train.
No more. You're at a temporary. Yes.
It's not like related to what they were talking about, but earlier you said that when the heart muscle gets worked, like the muscles in the heart get bigger. I don't know, like, how is that good? Because usually they say when your heart is stressed too much, it'll fail.
Well, it's a very good question. I'm trying to think the best way to say it. Part of the problem is being old or not old, unfortunately. As we get old, we're constantly rebuilding ourselves, right? That's why we have taken protein, rebuild ourselves. You don't do a great job every time. And eventually those errors kind of add up, and that's basically aging. As you get old and you rebuild this muscle a bunch, it doesn't contract as well together. It's not this nice, happy, awesome, squeeze. It's kind of more like a, and so that's usually the more common, actually the number one cause of heart failure is heart attacks. So heart attack is not enough blood flow to an area, the muscle dies and it doesn't contract at all then. And so that's more the reason why you start having this issue with it not contracting. Now, the interesting, this is, you got lucky on this one. So remember I said that kid had a heart attack, right? Because of my age, that's why I went to medical school. He actually has a defect in his heart. So do you guys know what this big structure in the middle that separates the two?
No.
You trailed off.
Are you talking about the Pajubin Valley?
So this is a septum between the two ventricles. Is the interventricular septum.